Hi, my name is Turnbull. I work for the Royal College of Nursing in Wales. We have 30,000 members in Wales, nurses and nursing students and healthcare support workers, and the biggest issue for them is protecting their patients' safety. When you're in hospital, you're very vulnerable, and the research tells us that the number of nursing staff looking after you and the skill level that they have makes a huge difference to your outcomes. Lots of industries have standards protecting the public. So if you get on a plane, the number of stewards and stewardesses is fixed in law. If you send your child on a school trip, if you put your dog in a kennel, all of those industries have safety standards connected to the number of staff. I think it's quite unbelievable, many people wouldn't know this, but that is not enshrined in law to protect patients going into hospital, until we decided that that's what we needed to do. We needed to put this law into place to protect patient care. The government at the time wasn't minded to introduce a bill, so we had to find a different way. Now, all of the members of the Senedd have an opportunity to put forward a private member's bill if they put their names essentially into a hat, and one of them will get drawn out, and that gives them the opportunity to put forward a private member's bill. And we were very fortunate because the member whose name was drawn out was Kirsty Williams. The next 2 years were extremely busy years, and our members really led the way. They started a public petition. Thousands of people, members of the public, signed that petition demonstrating their support. They also flooded members of the Senedd with postcards, and the postcards really telling their story of how passionate they were to protect patient care. And in the end, the then Health Minister, Mark Drakeford, was minded then to allow a free vote to his party on the issue, and that was critical because then we were able to get cross-party support from all of the political parties, so the bill was eventually passed unanimously. Because we passed this legislation, which was the first of its kind in the whole of Europe, Scotland immediately passed a very similar piece of legislation. That shows in itself the power of an example. And what has this done? It has said to the health boards in this country, it has said to the NHS in this country, that if there is poor care on the wards because you haven't employed enough nursing staff, this is your responsibility and we will hold you to account. I think it's been a very important journey because it's demonstrated why we have a Welsh Parliament. Because we can introduce a new idea like this that will protect the public and actually see it happen.